Work across 3 organisations at the present moment, Portsmouth NHS Trust, Southern Health Foundation Trust and Solent NHS Trust. Our services pretty much redefines, or at least we're trying to redefine, what a specialist diabetologist does. So we do 6 specific things inside a hospital, and everything else is done in primary care, the combination of virtual contacts and directly seeing patients or directly doing GP surgery visits all across about 83 surgeries right now. As regards benefits to patients, I think it's more looking at the whole system, and redefining the specialist role is part of it. So the right person is seeing the right patient, while the overarching point of this model is education and support for primary care, so as to help deal with greater challenges and more problematic people with diabetes. So that sort of stuff. It's more of a support network for primary care. That's the benefit for patients, so the whole system tends to benefit. I think what hasn't been done before is trying to redefine what a diabetologist or a specialist diabetes person does inside a hospital. And I think the main focus has been to try and create the clear blue line, which is not quite an area of debate. So, for example, when we talk about the 6 things we do, the part of the Super 6 model, we talk about antenatal diabetes or diabetes with pregnancy. Now, that's not possible to be done in primary care for multiple reasons, expertise being one of them, and that's also not in debate, because one of the fundamental things that happens in the NHS is a lot of debate as to who's best qualified. And those 6 areas, as has been agreed between us and our GP colleagues, are areas which are clearly and squarely within the specialist realm. So that stops the debates happening, and then there's a very clear identity what a specialist diabetologist will do inside a hospital. So that's probably the most innovative feature of it all. So the biggest challenge we had was change, and fundamentally we are trying to change the way diabetologists work. We're trying to use electronic means, virtual means, which is still, unfortunately, in the NHS, a very alien concept for a lot of people, and also for primary care to take on more load, but do a lot of it virtually rather than physically seeing the patient every single time. So I think that those are the challenges from different quarters. The way of working took some time to get everybody to adapt to. And also for, as I said at the beginning, getting a diabetologist to not just see patients, whoever comes to them, but being more of trying to sort of bring forward more of the educator roles. That's probably been the biggest challenge.